So, just as one might imagine, the Trump administration just approved Tennessee's plan to overhaul funding of its Medicaid program. A Trump overhaul basically means cut and destroy. Healthcare advocates in Tennessee are calling the decision reckless and irresponsible. I mean, this overhaul is happening with, well, overwhelming opposition, but also in the middle of a global pandemic. And as a number of uninsured Americans, the number of them continue to grow. The approval of the overhaul drew outrage from like 21 patient and consumer groups, including, but not limited to, the American Lung Association, the American Cancer Society, Cancer Action Network, the National Alliance on Mental Illness, and basically everybody else who does anything health related that isn't a corporate shill, which an argument could be made that some of these are, but I'm not going to make that argument right this second because we have other things to do, like get you the information that you need to help this fight. Okay. Anyway, the plan is basically a reckless move that would reduce Tennesseans' ability to get the needed health care. That is what those groups say. And they are urging the incoming President Biden, his administration, to halt the implementation there. You can help fix this. Go to tnjustice.org, tnjustice.org. Even if you're not in Tennessee, it's important for you to go do this because once one state falls, then they all say, hey, what a great idea this is to kill all those people. Let's come over here and kill them in your state. tnjustice.org. And then the place is called Stop the Blockleg, to add your name to the growing list of activists calling on the Tennessee lawmakers to reverse this decision. And looky here, there are people in the street protesting, which is what we need in every way. And in other healthcare news, the group Maine Healthcare Action is launching a campaign to get universal health care on the state ballot in 2022. Instead of proposing a specific bill, the initiative would direct the Maine legislature to draft and enact a universal health care plan by 2024. So see if you can live until then. Maine has one of the highest senior populations. Interesting. And one of the most annoying elected officials. I'm not going to even name her name. Anyway, it also has one of the highest poverty levels. Healthcare activists point to the economic research that shows that universal coverage would save Maine's healthcare system like a ton of money and keep rural hospitals afloat. Research indicates that Americans think the government actually does have a responsibility to provide health coverage for all. In exit polls from CNN, last year's primaries, nearly 70% of Mainers said they support a universal government plan over private insurance. So let's get moving, Susan Collins. Ooh, I said her name. Also, in related news, amid a deadly virus outbreak that has disproportionately stricken Latino communities, Illinois recently became the first state to provide public health insurance to all low-income, non-citizen seniors, even if they are undocumented, because human beings have a right to health care. And if you don't believe that, human beings live, the ones that you think don't have a right live right next door to you if you think you have the right. And, germs don't discriminate. Advocates for immigrants expect that this move by Illinois will inspire other states to perhaps do the same thing, building on efforts to cover undocumented children and young adults. Woo! Illinois was the first state to cover children's care and organ transplant for unauthorized immigrants. A handful of states and D.C. have since followed suit, and in 2019, California became the first to offer public coverage to undocumented adults when it opened its eligibility for Medicaid, the program there, to all low-income residents by the age of 26. Good stuff. I'm Julianna Forlano. Thanks for watching. This is ACT TV.